hips and feel the ASIS. And it's very minimal, but I can see that the left side's a little bit lower.
Okay.
Okay, and so we're gonna have the patient bring their knees up like this. And this is just more of just a general approach. We're gonna have them bring their knees together.
Yeah. So where this is just a pelvic reset. This really isn't fixing the specific issue. It can help though.
Pull them apart
And do you feel any difference in strength between my legs when I'm pushing?
and push. Okay. Go ahead and pull apart. Your left feels stronger, but it could be because I'm holding it with my left. My left is my weaker side. Okay. So that shouldn't, I didn't think that that would fix the issue, but it's just a good general approach. So since this one is facing a little bit more down direction, I'm gonna bring the leg up and push it in its opposite direction.
Good.
So I'm gonna push this, and then I'm gonna feel under L4, L5 until I feel a resistance point.
Perfect.
There we go.
Good.
And then feel here. So then I'm gonna have the patient push for about 3 seconds. 1, 2, 3. And then find the next resistance point.
Good.
1, 2, 3. And then the next one. 1, 2, 3. Okay.
So Mallory doesn't ever have any training in this. She's an MD, so she doesn't get the same training I do. But what she's learned through these 6 weeks, she was able to apply it and help her husband and able to fix his hips last night. So you can learn skills if you're an MD doing this, if you're working with a preceptor, or there's certain courses that you can take. So go ahead and recheck my hips to make sure it feels the same.
Yeah.
Good.
That's better.
What do you want to check now?
Okay. I can check. Well, I forgot to mention this, but you're going to look at how the feet are rotating. So when the patient's just lying, you're looking to see if one foot is maybe more resistant to falling to the side than the other.
Mm-hmm.
It does look like the left is still just a little bit less rotated than the right.
And if that's the case, it could be something in my back.
Okay.
But remember, my tendons are a little bit different. I'm an odd case because I'm pregnant, so my tendons are going to be a little bit more pliable and a little different than somebody who's not pregnant.
Okay, so then we're going to try and feel the first row. This might be easier, like Dr. Montrose said, when they're lying down. And it is. I think it is.
Walk your hands a little bit back. So when you're feeling it, it should be like right in the middle of that muscle belly, like here.
Okay.
Mm-hmm. Good. Right there and there. Perfect.
Oh, okay. Yep. Mm-hmm.
So you see how it feels harder and it feels different than the normal trapezius muscle does?
Yeah.
Yeah.
Okay.
It feels different than muscle tissue.
They feel equal.
Okay.
So that's good. I don't think you really have any problem with the first row that
Okay.
I can feel.
You can go ahead and check my neck in this position too. So it's just easier to check a neck when a patient's laying down because I'm not going to give you any resistance than if I was standing up.
Okay. So the suboccipital area
Mm-hmm.
and then down.
And so you're on the transverse processes just like you were when I was standing. And you're just kind of translating back and forth, and then you're checking rotation of my neck.
So I'm looking too where the chin is lining up with the shoulder. And it looks like it's even on both sides, like it's hitting. And then I'm going to do this extension. And this
So
is
side bending.
side bending. It looks like good mobility.
Good. And then did you feel anything when you were translating back and forth? Because I think it's very minute, but if you go back up to C2, so here, do you feel the difference where it feels here
Mhm.
than here? So there's a little bit of an issue here.
This left side feels
Yeah.
a little tighter.
Good. So go ahead and take me into a position that I don't like.
Okay.
So she's doing muscle energy. It's one of the easier things
Oh.
to me to do. Good, there you go, good. Good, you feel that?
Yeah.
Good. So you took me to my resistance point,
Mhm.
and now you're gonna do what?
I'm going to have you, okay, so we tend to forward flex, and I kind of noticed that with her. So I'm going to put her in a little bit more extension because that's what she doesn't want to do.
Exactly.
And then push until I feel the resistance, which I feel right here. And then I'm going to have her try and push her head to the right, try and to the right. And then relax.
Good. And then you're gonna take me more into extension, and then more this way. Perfect.
And
And you
then,
feel how it got harder underneath your hand there?
yes.
Perfect.
And then try and push your head to the right again. Good.
Good.
And then we'll just do one more.
One more. Good.
And then go ahead. And good. Okay, so then we're going to check our work, and it does feel a lot looser. So
Good.
you just got to make sure you come up, feel where the occipital part is, and then like move just below, which is something else.
whoops, you want to check. So you can't put me on my stomach, but you can lay me on my side, or what you can do is, so you're at a little bit of a disadvantage because you can't feel my back the way, but you can feel when I'm sitting like this. So you can come over and feel on either side and see if you can feel a difference. And because of my stomach and what happens with pregnancy, you're going to see more lordosis in my back, which is what happens. So you should feel a tightness in my lumbar spine, especially compared to my thoracic. And one side might feel worse than the other. I can't tell.
You can tell though, the thoracic, these muscle bellies are a lot softer now.
Okay.
And then if you push down here, it's a lot harder.
Okay. Is there one side that's worse than the other?
The left feels a little bit worse.
Okay. So you can put me on my right side, so my left side is facing up, and you can treat that way.
Okay.
So, a couple things that you can do. So, do you remember how we feel at the specific location and bring the leg back, or do the twist? You can do either one of those in somebody who's pregnant and on their side.
Okay. I'll do the twist.
Okay.
I think it covers a lot. So we pull the patient's bottom
Yeah.
shoulder,
Yep. You create a twist motion.
and then we're gonna bring her knee up.
Okay.
And then push the butt this way
So-
and her shoulder this way.
So look first to see where I'm rotating less. So, is it easier to push my shoulder, or is it easier to push my butt?
This is way easier to push. As
Good.
I'm pushing here, I can keep going, but as I'm pushing here, it's not.
Perfect. So you know that there's a restriction in my lower, which makes sense. Move your hand more. There. Perfect. So, yep, you're just kind of monitoring here and bringing this forward, and then I'm going to push backwards against your resistance.
Okay, try and push your butt up. Relax.
Good. And then you can bring me more forward and create more. Good. Good. And then go ahead and you do it again.
I have to move her. She's pretty flexible. So,
Good. And if you do that quickly, where you create a quick movement, so if you put your hand here, and then you put your hand here, and you create a quick thrust, you might be able to facilitate a pop. So quicker than that, almost. So it's one quick movement. I can show you on you.
okay.
So go ahead and lay on your side for me. So you have to have the position, the patient in the proper position. So I take them to the resistance point, and then just do a quick motion like that. Switch sides. That's not your problem side.